Good day, everyone. Our report is about the chapters 13 to 15 of the AUBF book. A 24-year-old man was brought to the ER because he was accidentally hit by a car. Hours after the accident, he experienced severe bleeding in his left leg. The man was found to be homeless for about a year and has no permanent address in the city. He also has no family members with him. The laboratory findings shows that the RBC count, hemoglobin, and hematocrit are way below the normal values, while the WBC count is increased. The segmenters are increased, lymphocytes are decreased, monocytes are within the normal value, the eosinophils are increased, and the basophils are within the normal value. The platelet count is way below the normal value, which indicates the bleeding of the patient. The man was admitted upon knowing the results of the laboratory exams. He was given 3 units of full blood to alleviate the severe bleeding. His left leg was also amputated due to the car accident. The patient also has lesions in his arms and legs, and he complained of abdominal pain, persistent coughs, and nausea for 3 days upon admission. After 3 days, the laboratory findings shows that the RBC count, hemoglobin, and hematocrit increased as compared to the previous results, but still they are below the normal values. The WBC count continued to increase, and for the differential count, the segmenters are still increased, lymphocytes are still decreased, monocytes within the normal value, eosinophils are still increased, and basophils are within the normal value. The platelet increased, but still is below the normal value. Upon transfusion of 3 units of full blood, the patient's hemoglobin and hematocrit remained at low levels, while the WBCs remained at high levels. The doctor ordered another complete blood count with peripheral blood smear. The laboratory findings shows that the RBC count, hemoglobin, and hematocrit increased slightly but still below the normal value. The WBC count is still increased, while for the differential count, the segmenters are already in the normal range, the lymphocytes in the normal range, and the monocytes in the normal range, while the eosinophils are still increased and basophils in the normal range. The platelet count is increased as compared to the previous result but still below the normal range. For the peripheral blood smear, the RBCs were seen microcytic normochromic cells and inadequate in number. White blood cells are adequate in number with eosinophilia, and platelets are inadequate in number. The peripheral blood smear shows eosinophilia, which means that the eosinophils are increased. The doctor also ordered gram stain requests of the wound of the amputated leg. The gram stain results were RBCs are seen few, WBCs are seen rarely, and few gram-positive cocci in singly were seen, and no spore-forming bacilli were seen. The doctor ordered gram stain requests in order to rule out the cause of the high WBC count of the patient. After 3 days, the doctor ordered fecalysis and fecal occult blood test. The patient was prepared for the fecal occult blood test, and the patient were not allowed to eat rich colored food as to not interfere with the fecal occult blood test. For the results of the fecalysis, the color was black, the consistency was soft, and hookworm ova were seen at about 50 to 56 ova per cover slip. RBCs were seen at about 10 to 15 per cover slip, as well as WBCs at about 8 to 12 per cover slip. The fecal occult blood test shows positive results. The smear made from the stool of the patient shows ova of the hookworm. As for our conclusion, before the accident, the patient was found to have severe anemia of chronic inflammation due to hookworm infection. Since the patient was homeless and has no permanent address, he might have acquired the hookworm infection from ingesting fecally contaminated food or drinking fecally contaminated water. As of now, the doctor is continuing continuing to give medications to the patient to decrease the parasitic load and as well as to compensate and to increase the blood counts of the patient.